Session two of the first 2025 Widening the Pipeline virtual training will explore how the new White House administration's immigration policies have affected access to maternal health care. We're joined by Emma Cordover, who is a digital producer at Politico. In addition to covering sustainability and labor topics, Emma has also helped produce Politico's Women Rule newsletter. Her reporting for Women Rule ranges from an interview with AFL-CIO President Liz Shuler on how women are changing the labor movement to interviews with state lawmakers on how the politicization of in vitro fertilization has spurred fertility care coverage bills across the country. Emma, thank you so much for joining us today.
Thank you so much. I'm so excited to be here. It's really an honor, and I'm gonna have a lot of fun talking about this one in particular because it's just, yeah, it's a really great one to talk about. So thank you so much for having me.
Well, I know you have prepared some slides for us to talk
Yes.
about your work and particularly that one newsletter about this topic. But before you do that, let's learn a little bit about your lived experience and who Emma Cordover is. So start by telling us about your background and your entry into journalism.
Oh, sure. Yeah. So I am from Washington, D.C., actually, born and raised. My mom is from Spain. My dad is from the Bronx, New York. So an interesting little mashup there. But I grew up going to Spain back and forth twice a year my whole life. My twin sister currently lives there, and the rest of my mom's side of the family live there as well. So I kind of grew up with this very two-sided upbringing, I would say. I was kind of straddling two cultures at once at all times. And I like to say that that's what drew me to journalism, just because I was a very curious person and I wanted to understand everyone and everything, I think. And I feel like journalists' job is to do that and to explain what's going on in life by understanding it well yourself. So I graduated from Cornell in 2022 and I started at Politico shortly after as a producer. Um, and yeah, I've been there for 2 years now. So a lot of what I'm going to talk about today, I think I've learned very much on the fly, and a lot of what I've learned has been thanks to amazing reporters and editors that have believed in me and listened to my ideas, and given me all these opportunities. So I just hope that I can impart some of that knowledge to you all today.
Well, one of the things that I find so interesting about someone who has your set of experiences is that you do have such a broad range of
Mhm.
opportunities to learn about various topics and, from again, sustainability to reproductive health. But one of the things that I found most interesting when the newsletter popped up in my email was thinking about how, when covering immigration specifically, uh, the broad-reaching aspects of these policies. Reproductive health is something that personally, as a journalist, I have supported journalists in learning more about not only in the US, but on the African continent as well. So that when I read your newsletter, I thought this is a terrific way to add context and depth and to help people understand that it's not just about that point of arrest and deportation, et cetera. So I'm going to let you tell us
Yes.
how that topic landed on your radar screen and walk us through that.
Awesome. Yeah, I'm definitely gonna talk about how there's this policy overlap. I think those kind of small intersections in policy outcomes, I think, is where some of the freshest and most, I think, important reporting comes from. So I will definitely get into that. But yeah, I can share my slides now.
Yes.
Okay, I think we are good. So what I'm gonna do, I think, is how I've set this up is a kind of step-by-step process with numbers. So I hope that's okay with all of you that I numbered it. And I'm just going to share some details about my process writing this story that can hopefully help you all do the same in your communities. And I think with immigration coverage, especially, there's such a continuous stream of news around it at all times that it can be harder to find a unique angle and a fresh angle. So I think, yeah, that's something that I will get into in a moment. So step one, an idea, of course. You have to start with your idea. And like I said in the beginning, I'm really excited to talk about this story specifically because I think its genesis is a really wonderful example of why I love journalism so much. What happened was I got dinner with a friend on a Friday night. We were sitting in her apartment having dinner. We were catching up about work and life, and she just started telling me about how difficult and chaotic her work life had become. She, for context, she works at a hospital here in New York at their clinic for undocumented migrants as a project manager, specifically for the postpartum depression clinic. So she works in giving postpartum depression care to undocumented mothers. And we were talking, and she told me that work had just been absolutely crazy since Trump's immigration executive orders had hit the news since his inauguration. She said that patients were extremely scared. She said that they were not showing up for visits. So she was explaining that as a result, the clinic had shifted its priorities completely and was holding legal info sessions and what to do if ICE shows up presentations and had just kind of become this community resource center as well as a hospital. They were trying their best to convince patients that a hospital was still a safe place to be, that their care was important enough for them to continue in treatment, but it wasn't always working, and a lot of these mothers were just not showing up and even grappling with what to do with their newborn if they do get deported. So she was really worried about these mothers since postpartum care is so important. And I sat there listening and talking with her, and I myself started to get worried and frustrated and confused, as is kind of the natural reaction, I think. And it just lighted this fire in me a little bit, especially since I hadn't yet come across any reporting about this particular issue, the healthcare fallout from immigration policy change. I hadn't seen any reports yet on this particular kind of overlap. So on the bright side, I think that these are the moments from which the best stories are born. In my experience, I think when you're passionate about something, when you find something out anecdotally like this, like at dinner from a real live person, and a primary source, I think it's where some of the freshest and most important reporting comes from. And so I got home that night and I knew that I was authoring the Women Rule newsletter the following week. And so I started just looking into how exactly I might be able to cover this issue, and doing a little bit of research. So a little bit of background. As we all probably know, Trump's immigration policy executive orders dominated the news cycle for the first weeks in office, his first weeks in office for almost all of January, I think. He obviously made a slew of policy changes related to immigration coverage in his first moments in office. And there was actually a report from my colleagues at Politico titled Mass Deportations Haven't Arrived, but Trump's PR Blitz has. It's there in the middle. And this one stood out to me that week in particular because I thought that the factual distinction between the story that Trump's media team is trying to tell versus what the actual policy outcomes were was really important to underscore, and I think could be kind of conflated. And I knew that I wanted to echo that in my story. And I think it also, what this research made clear was that there was indeed a media blitz related to immigration that was intentional and concerted. And it was important to me that I established that there was actually this kind of immigration blitz happening, that could be spreading fear and spreading confusion within communities. So as you can see, blitz was a very popular word in a lot of other headlines as well. So the next thing I wanted to focus on in my research was the birthright executive order. This was one of the most notable immigration policy changes that Trump tried to make, was repealing birthright citizenship. He attempted to undo this law that grants all children born on U.S. soil automatic citizenship, but like many of his other decisions, it was challenged by the courts. And then the legal development of this EO started to dominate the news cycle as well. So this one stood out to me, obviously because of its likely kind of long and very tumultuous legal road ahead, but also because it affects a particular demographic that I would be covering, women and mothers, of course. Not just women and mothers, but I think it was a kind of specific focus. So, and although birthright citizenship was in place then and is still now, I kind of just hypothesized that the uncertainty around its future could only add to the blitz of fear and confusion for immigrants, especially new parents or expecting parents. And so I thought it was important to mention that. So, another of the most notable immigration policy changes that Trump put in place was allowing ICE into sensitive locations, including schools, churches, and hospitals. And it was this executive order, actually, that my friend mentioned to me specifically was causing the most chaos in hospitals, which makes a lot of sense. I think she just said there was a lot of confusion about what it actually meant for ICE to be able to show up, and that's what was kind of preventing a lot of these patients from continuing care. And I also think that it was this executive order that really cemented the policy overlap between immigration and healthcare, that now the two are kind of very specifically linked and related. And I came across a lot of really great local and more healthcare specific reporting about how patients were skipping visits. Like here, there was a nurses union that spoke about it, and more kind of local reports about patients skipping visits. I hadn't seen any national reporting on it yet, but I found a lot of really great local stories about it. So I was glad that that was kind of being confirmed. Well, not glad, but we do what we can. So step two, of course, is your pitch. Um, and I think the hardest part, or one of the hardest parts for me in reporting in general, is the jump from I'm passionate about this, I'm confused, I'm wanting to figure this out, to I'm going to write about this, for a Politico audience, or I'm going to write about this for this particular newsletter. I think pitching is a lot of fun, especially when you care about a lot of things and there's so much going on, especially now. But my ideas and ideas in general can be lofty and hard to pin down. So I really wanted to make sure that I packaged this very complicated issue in a way that would land for my editor primarily, and of course for our audience, which is what she has in mind. So I sent her this pitch. I have a screenshot of the Slack that I sent her. I told her that I wanted to figure out how to cover the mass deportations and their effect on women. I later wrote, I wonder if we could look at how deportations affect mothers or something to that effect, and how medical and maternal care professionals / childcare professionals are responding. Are adoption services seeing a boost? Are childbirth complications increasing as mothers choose not to seek care? So I wanted to focus on policy action and reaction and just causes and effects. Specifically, like what do people need to know about how these policy changes are affecting people in daily life? And then also, how are these policy changes affecting large organizations, including government organizations like welfare groups or, government finances or businesses? So I wanted to make sure that the scope, of the effects was broad. And I wanted to say, not just this is happening and I think it's important and it's devastating and it's hard, but I wanted to go further and say, what's happening here is going to impact this, and this specifically, and this is why that matters. This is how long the effects are going to last. This is exactly who will be affected. So I wanted to make sure that that was mentioned in my pitch from the get-go. And luckily, yay, she wrote back saying that she was on board with the pitch. And so I got to work finding sources. So for this project, I wanted both immigration experts and also healthcare experts to speak on the issue. And I also really wanted to get a specifically women / mothers centered organization. And then within that, I of course wanted to make sure I got both sides of the aisle, both perspectives, or, at least one of each, and then an established nonpartisan voice. So what I landed on was KFF is a nonprofit health policy research organization. I spoke to the director of immigrant health policy there. Then the Migration Policy Institute is a nonpartisan think tank. I spoke to a senior policy analyst there. The Center for Immigration Studies is a pro-immigration restriction think tank, so they're in favor of Trump's EOs. Um, I spoke to a director of policy studies there, and then Moms Rising is a really amazing organization I found. They're an on-the-ground coalition of um, moms and others with members across all 50 states. And so I spoke to the executive director and CEO of Moms Rising for the story. So for sourcing on this story, I think sourcing on a strict deadline, like a newsletter that comes out weekly, can be slightly challenging just because there's a very limited window. And you want to write about something timely, of course, too. But I find that when you are writing about something timely, usually you get responses pretty readily, especially from groups like these who, want to share information and spread knowledge. So luckily I did hear back from all of them and I was able to set up my interviews. So here is a list of all of the interview questions that I had prepared. Things I want to highlight here is just the focus again on the cause and effect of the immigration policy changes, how this could affect people in real time and how it was affecting people in real time anecdotally. And I also really wanted to make sure that I had the most up-to-date hard data on what exactly was going on, the number of deportations, the demographics of those deported, how many are women, how many are children. I think especially because of what I mentioned at the beginning, there's potential for a lot of confusion about what actually is happening with the policy changes. So I wanted to make sure that I got, straight from the source, accurate and up-to-date information. And then after that, I wanted to zoom out and just get big picture perspectives on how all these changes might have, I think what I said is cascading effects, yeah, on healthcare, childcare, hospitals, and anything else that I might not have thought of. For yeah, just like the larger zoomed out perspective on what this all means for the country and for healthcare professionals and everyone involved. So yeah, these are the ones that I had prepared. I think during the interviews, obviously there was a little bit of more kind of back and forth and conversational questions, but these are the ones that I had prepped. So my findings. What I found in the interviews, firstly, and I think most importantly, was confirmation of what my friend had been telling me about how the policy changes were affecting patients in real time. From the Moms Rising conversation, I heard a lot about family separations, children in schools being afraid that they might not be able to go back to school or being afraid that their best friend might not be able to go back to school. She told me some really kind of harrowing stories about ICE raids in public. I think she mentioned one was at a Waffle House. There was one that even I think Dr. Phil went to. So it was like this kind of public entertainment-y thing. It was a fascinating conversation and really, yeah, just harrowing. But I got a lot of really great on the ground information from her because she was in touch with this really big network of people across the whole country, which was amazing. Um, and then I also heard from Valerie Lecarte, who was the MPI researcher, the nonpartisan think tank, in her own words, that Trump's EOs were making pregnant people particularly insecure. And she emphasized that it was because of the birthright changes, which kind of also confirmed my initial hypothesis that this birthright confusion and uncertainty can only be adding to the fear. And she also added that the uncertainty around birthright makes women with even semi-legal status insecure as well, which I wouldn't have thought of. And I found that really important to speaking to the larger cascading effects of these policies, that they're affecting not just even the undocumented migrants or even just their children, but even people who are going through the legal process, and people who are, allegedly doing it the right way. So I thought that was a really important thing to have in the story. And then after parsing through the transcript for anecdotal quotes, I wanted to look for the best policy argument related quotes. So in red here, I have quotes from the Center for Immigration Studies researcher, or I guess maroon. I don't know, that's red. But what I gathered from the conversation with her was that her perspective was that this conundrum, I guess, this issue with healthcare and maternal healthcare, while very difficult and sad, was just a representation of how lax immigration restrictions in the past have caused harm. And she said that the concerns coming out of communities, so patients skipping appointments, avoiding treatment, was actually a result of politically motivated fear mongering from within immigration advocacy groups. So, as she saw it, it was liberal groups trying to paint the president in a bad light and exaggerating the potential negative effects of his policies to be able to achieve that. And that, this wasn't what the government was doing, trying to spread fear or trying to get people not to go to their appointments. It was actually, the advocacy groups that were doing it from a political vantage point. And she also added, which is another important policy argument, I thought that the healthcare fallout from this kind of issue would cost Americans a lot financially, since a lot of the government funding was being allocated to helping undocumented migrants and their US-born children rather than helping American citizens. And on the other hand, the quote in that's not in red here is from the KFF healthcare researcher, and what she um, thought was that what's happening right now, the patients skipping visits, the people avoiding healthcare because of the executive orders and because of immigration-related fears, is actually going to cost Americans a lot more in the long run because their uh, issues and healthcare problems can become more complex and more expensive to treat later on. So that was an interesting contrast the other researcher. And then it was also really important for the story, like I said in the beginning, that I get hard data and statistical quotes to statistical evidence. Um, and these two are actually as well kind of in contrast with what the researcher was saying in the previous slide, that actually, according to a study report from the state of Florida, immigrants without legal status accounted for just 0.8% of hospital visits and just 0.8% of emergency department visits. So the numbers were actually very, very small, and not significant enough at all to cause, taxpayers a big change. And then she also mentioned that data from Trump's first administration showed that his immigration policies, although maybe it wasn't, the government doing that, it still showed that his immigration policies led to growing reluctance among some families from participating in programs, um, either for themselves or their children who are US born because they didn't want to draw attention to their immigration status. So that was another kind of counterpoint to the other quotes. And I think something I want to mention here is that one of the biggest challenges to this story, and I think maybe generally for timely immigration related stories, is that everything that I'm writing about is happening in real time and is ongoing. So there isn't yet the data is unfolding in front of me like right now, and there wasn't yet any analysis or really comprehensive, conclusive info on what the effects the policies were having in the past like 3 weeks since he'd been in office. So I had to rely a lot on kind of just data from the past administration. And when I was asking these researchers, how many mothers have been affected? What is happening exactly right now in the past 2 weeks? They were like, well, we don't really know that yet because we don't have enough data. Um, but I think all of this past information can really help inform what's happening now, since we do have another administration to compare it to. So step 5. For this story, since it's a newsletter format that comes out weekly on Fridays, like I mentioned, it's important. It was important that I establish a news hook to let readers know why this is all timely. And for the news hook, I wanted to choose the most grabby, jarring bit of recent immigration news to start the piece. And that to me was the Guantanamo Bay plan. It also worked well because the first flight of migrants had been sent to Guantanamo Bay just that Tuesday, so days before the story ran. So I thought it was a good hook and a good kind of piece of color for what was going on immigration wise in this administration. And then, of course, we have the nut, most important part of the story, as they all say. And I think For the nut graph, I wanted to underscore, like I mentioned in the beginning, the factual distinction between Trump's media blitz and the actual number of deportations. I wanted to highlight the overwhelming nature of the news around the deportations and how that might um, mismatch with what's actually happening, and how this might be contributing to the fear and confusion among communities. And then after that, I wanted to bring in the whole point of the story, which is that there is a specific subset of those immigrants that could be uniquely impacted by these policies. It's not just patients skipping healthcare appointments in general, it's specifically people who are expecting a child or have just had a child. And then after the nut, I had my top quote, which was a quote from the nonpartisan think tank researcher Valerie, and then I went into the rest of the story. But yes, we love a nut graph. And then step 6 is edits, of course. I always stare at the Google Doc. They tell me not to stare at the Google Doc. I stare at the Google Doc anyway. But some things that I find helpful in kind of final edits are linking to background reporting. I think obviously this has a benefit to the reader, but I think for me, it actually helps me be more concise in my writing because I can trust that if the reader does need a longer explanation of what's happening, that they can just follow the link. I can get caught up in wanting to specify and explain everything really well and thoroughly. And I think linking is a good interactive way to get the reader engaged and also can just make you kind of trust that you can say what you need to say and leave it at that. Um, and then a top quote and a kicker quote. I love a kicker quote. I think especially when you have um, a subject that's sensitive and emotional, I think kicker quotes can be a really good kind of final flourish to the story. Um, and if you have good quotes, I say throw them in there. They're always fun. So yeah, I think lastly, I wanted to leave you with 4 tips on how to do this in your community. So I can go through each one. First, know your audience. I think a lot of this is self-explanatory, but specifically here, what I'm trying to get at is your idea. If you have an idea and it's yours and you believe in it, it's probably a very good one. I think the only thing that stands in the way of a good idea and a good story is the packaging of that idea. So I think if you can figure out how to package something in a precise and digestible way, I think you can write about anything that you want. I think it's about knowing who's going to read it from your editor to your actual readers, I think. Of course, your editor has your readers in mind, but keeping that in mind and understanding that you have to frame it in a way that will be understandable, I think is really important. And just knowing them, get to know what your editor likes and what your readers like. And I think that, again, very self-explanatory, but trust that your idea is a good one. It just needs to be packaged in the right way. Secondly, and I think this is a little bit more specific, but it does get at what Rachel and I were talking about in the beginning. And it's focusing on small overlaps in policy outcomes, I think can lead to fresh angles. I think finding the intersection point between 2 very long lines of reporting can be very insightful, and can be a helpful way to just come up with a story idea even in the beginning. These 2 lines in this case are, immigration coverage and healthcare coverage, and finding a point where they both intersect can be I think can provide really important and necessary reporting when covering huge topics that are already getting so much attention. Yeah, it can be intimidating and hard to just find a new angle. And I think finding that intersection point can be great. Thirdly, follow your gut. I know these are all kind of very cliche, but I promise I have something to say about them. I think, and this relates to what I said in the beginning, but if your story is, if you have an idea for a story, it is probably a good one. If you're passionate about something, if you're sitting at dinner feeling fired up or observing something happening in your community, it's probably going to be an amazing idea. And I think if you have a gut reaction to it, readers will probably have a gut reaction to it. And if you're, yeah, talking with people and feeling like you're getting excited about something, it'll probably be a great idea. And then the last one, I know I'm just at time, but it's just source widely. I think for these stories, you can be passionate about them, and it can be difficult to want to hear from all sides of the puzzle, I guess, or all pieces of the puzzle. But making sure that you get every single perspective in there is only going to make your reporting stronger and only going to make your whole argument and everything that you're trying to say even stronger. So making sure to talk to as many people as you can, even on a deadline. So yeah, that's all. I hope this was helpful, and I can take questions if we still have time.
Emma, I got to tell you, this is probably one of the most brilliant presentations I've seen for widening the pipeline. I think what you have highlighted here is something that I think a lot of particularly young journalists don't unshare your screen, by the way, so that we can see
Oh, sorry.
the full Emma here. Uh,
Back.
but something that sometimes young journalists forget in that we must become experts on five different topics every other week. It's and the work and the commitment of doing the research, finding the right people to talk to, thinking deeply about these issues can yield some tremendous work. And this has been a terrific example of that. So I'm so grateful I clicked on my newsletter that day when I saw it. It's just the perfect addition to this conversation. So while we wait to see if there are any questions, I had one question that I wanted to ask you, and that is, it's related to sourcing, and your source was your friend who you're sitting
Right.
having dinner with, and you're whatever. As the idea developed in your brain, and you thought maybe this is something to pursue, how do you um, navigate that relationship? Did you ask her to sort of validate some things that you were thinking about? Do you touch base with her? Do you worry that maybe you'll obsess and make her feel like I'm not going to talk to Emma again because she's going to turn everything I say into a story? How do you tell us about that relationship?
Yeah, that is a great question and something that, yeah, I experienced it while it was happening, but I didn't think about it afterwards. So I'm now kind of processing that in real time. But yeah, there is always a kind of interesting relationship. I feel like as reporters, when you say, "Oh, I'm a reporter and I want to write about something that you said," a lot of people can be like, "Wait, what is, there's just kind of a frenzy. She is my good friend, so and she knows what I do and she supports me very much. But there was definitely, I think, initially a I sent her a text, I think an audio message saying, "Oh my God, Juli, like I really want to talk about what we were talking about. I'm writing the newsletter this week, and I think it would be a really good topic." And I said, call me later if you wanna talk about it. I really I want to make sure that it's okay with you that I write about it. And I want to make sure that whatever you want, whatever involvement you want in the story, you can have. So whether that I was willing to quote her, of course, and get her as involved as she wanted to be. She was worried. So we had a call, and she was worried about going on the record. I think, which makes a lot of sense. That healthcare providers are always reluctant to go on the record. I tried to get other healthcare providers for the story. There's a lot of HIPAA stuff there, though, that they can't really breach. So she wasn't willing to go on the record, but she I think felt a lot better after I told her my entire plan for the story. I said, I just want to write about this on a national level. She asked, are you writing about it locally, about New York specifically? And I said, no, I want to talk about it broadly. This is who I want to talk to. This is who I think could have, this opinion and that kind of thing. And so I kind of walked her through my whole process. I told her that I sent my editor my pitch. So I talked to her, I sent the editor my pitch. And then once the editor confirmed, I was like, yes, okay, we're good to go. And then we had another call. We are friends, so we call a lot. And not all of them were related to this report, but I just kept her very much in the loop. And she was really excited. I think for stories like these, there can be a hesitation about I want to make sure this is represented well, but ultimately we want and they want this coverage. They want people to talk about this. It's going to help them in the end. I think reporters have such power in that way. And again, it's like I said in the beginning, the story is just such a reflection of how amazing journalism can be because you hear about something hard and devastating, and then you can actionably do something and write about it. And, you know, however the impact manifests is not up to you, but you know that you have informed the public and you know that you have done your kind of informational duty, which I think is really powerful. But yeah, I hope I answered the question. I think I just kept her very involved and I definitely asked her before I did any sort of had any sort of communication with my editor. And I sent her a draft like right before it was going to publish and she was very, very happy with it, but she wasn't willing to go on the record, of course, even though I did.
I get that.
Yeah.
I guess another thing I wonder about, I guess if you had to give advice to the fellows is to really be mindful of these kinds of reactions. In other words, if you do have a friend or somebody you meet at a party or whatever who offers you a tip,
Mhm.
uh, if they do sort of back off or recoil or whatever, don't let that be sort of you drop it. Find someone else to talk a little bit about how to sort of navigate that.
Yeah, yeah, that's a good point. I think it may seem like your idea came from this one interaction from somebody, but I think ultimately your ideas are your own and original, and you gather inspiration from myriad things throughout life. So I think you can treat a tip from somebody as, oh, this was pointing me in the direction of this story. Whether or not they want to be involved is, of course, up to them. But I think don't discount, the idea completely just because the person that gave it to you no longer wants to be involved. I think if it's in your head, there's always a way to execute it. And yeah, I think if you and persistence is everything. That is, I think, the one thing I've learned throughout reporting is I think if you have an idea, it's probably, like I said, this is probably a good one. And I think even if it doesn't end up as the exact story that you thought of, it will end up, if you persist with it. I think I can't name a single time where this hasn't happened for me. That if I've been persistent with something, maybe I didn't break the exact news that I thought I would break, but I ended up with a story, a product, at the end that I was proud of. So yeah, just take ownership, I guess, over your ideas. I think just because it came from somebody doesn't mean that it didn't, that you weren't, involved with it as well.
Great advice. Let's start with the hands I see raised. Gabriella, introduce yourself and ask your question.
Hi, Emma. Thank you so much for your presentation. I really appreciated the dissection of all of your steps. I'm Gabriela Nunez here in Atlanta. I have a two-part question. One, what was it like, or what sort of edits did you receive, or type of questions you received during the process of writing your piece? And then second, did you learn any new information that perhaps inspired your next piece?
Okay, great questions. I think in editing for this one, I I often get this I think every journalist will get this, but just making sure that tone is even and not charged with emotion, I think is the biggest thing for me, especially with talking about this current administration. I think it's been a thing for other stories that I've written that my editor just makes wants to make sure that my tone is factual and even toned, and not too punchy or too exaggerated. And I think that's the most amazing advice. Um, I think as a writer to just detach yourself a little bit. And it can be hard again with sensitive topics like these, but I think I got a lot of feedback on that. And then otherwise just kind of conciseness, cuts and wording choices. And she was the one that suggested that I talk to the MPI, which is a nonpartisan think tank. I think initially I was only going to talk to kind of the opposing sides, but she was the one that suggested specifically someone from the center. So I appreciated that a lot. Um, and then the second question, I definitely learned a lot of things that I didn't know of before. And I'm writing the newsletter again in a couple weeks. And so I'm hoping to integrate that. I mean, the thing about this topic is that it's changing every single day. I think there's been just this week there was more developments on the birthright executive order being challenged again. Um, there's more Guantanamo Bay updates, so there's a lot of timely things to write about. I think Yeah, I think I would love to cover what happens with the birthright EO and how that, I feel like if that gets changed, I mean, obviously it's gonna change a lot of lives, and a lot of decisions and just change the framework, I think, even culturally, of the United States. So I would love to do a kind of deep dive on that, fallout and just keep up with the immigration news and how it's affecting healthcare. I think I can only imagine it continuing to kind of spread confusion and fear, and uncertainty. So yeah, I hope to keep up with that. But yeah, again, I'm just kind of like watching for all the developments and making sure that I'm up to date and yeah, reporting on the newest news. So I hope that answers your question.
Thank you.
Thank
Let's
you.
go to Alicia.
Hi, Emma. I'm Alicia Brown. I work at States Newsroom. I'm based in North Carolina and I write a Reproductive Rights newsletter. Thank you so much for your insight today. I have a little bit of setup for my question. It's just like retracing what you said about your process for the story, which came from a friend, which sometimes are always the best ideas, right? So you said you're pegged because the news was so, I mean, the cycle is still very quick, but obviously it was causing a lot of fear among immigrant women and pregnant women. So you said your peg at the time was Guantanamo. And I noticed from your timestamp of the newsletter, around the same week, 5 immigrant pregnant women filed a lawsuit over Trump's EO questioning the 14th Amendment, right? Or birthright citizenship. So when the suit came down, did you say, okay, I'm gonna have to like just talk about that next time? Or had you already filed your story? Just because I know I think, does your newsletter come out on Fridays? I just subscribed. But yeah, just wondering what that process is like because newsletter writing can be so laborious and you're like, oh, this just happened and like I have to talk about it tomorrow or next week or something. Does that make sense? Does my question make sense?
Totally, totally. There's another newsletter that I write, that comes out on Wednesdays, and there's been so many times and it comes out in the morning, so there's been so many times where something happens at night, and I have to like rewrite the entire top, and I'm just like, ugh. But that's news. But in this case, I think this particular newsletter is particularly laborious. I think the top is always original reporting. And it's pretty long and it's kind of a like intense process, and edits usually get done on Thursday before, so that we can get it to production for a copy edit on Friday and then get it scheduled. So there is kind of like a shift back in the timing. And so I think I had the news hook set by like Wednesday night, Thursday morning, and wanted to get it over to my editor around Thursday morning, Thursday midday. So I think it wasn't a dramatic enough like change in news for me to rewrite. And I really wanted to put the Guantanamo Bay stuff in there just because it's I feel like so representative of the vibe, like that it's just like it's a kind of very grabby, kind of ridiculous thing, or just kind of what's the word? Rare, odd, out of the ordinary thing for Americans. It's kind of like we all know Guantanamo Bay as what it is. Anyway, so I thought I really wanted to keep that in because I feel like it was reflective of the fear spreading and the fact that the facility is only equipped to hold 130 and he's planning to send 30,000, was also a reflection of kind of the mismatch in speech and media speech and then action. So anyway, I think yes, sometimes it's definitely worthy to rewrite, to my own chagrin and to all of our chagrin, but in this case, I really liked the Guantanamo Bay hook and I wanted to keep that in. But yeah, I mean, in this case, I think could have been another case where I had to like rewrite it. And I think again, yeah, since this is an ongoing thing and the birthright legal process is so long and it's going to be long. The experts that I spoke to, they're just, yeah, I mean, it's going to be a very very long and like complicated multi-step thing. And I think there's probably going to be more lawsuits like that one. So I thought it was, yeah, appropriate to kind of to wait and cover all of the birthright legal developments in another piece or just like as they come separately from this like particular newsletter. But yeah, I hope that
Um, Monique.
Yes. Hi, I'm Monique Welch. I'm a diverse communities reporter from the Houston Landing. I apologize for my voice. Like Jesse, I'm battling a little cold symptoms, so I'm losing my voice daily. But wanted to really appreciate your presentation. At this kind of moment, historic moment in journalism in the country, really, a lot of journalists, even if they don't directly cover immigration, will probably have some immigration stories. And I think I'd be foolish to think that I probably won't be looped into some things. So this provides me a really great kind of roadmap on like different story angles. But I'm thinking like from a local level, because I've done a lot of stories within the Black maternal healthcare space, particularly with like disparities, and in Houston, it's pretty bad. So it's never ending to write about. So I'm thinking that this could be a good fresh angle with some of my expertise in that to kind of pair, but focus on immigrant communities. And so working in a local publication, I'm thinking about any suggestions you might have to kind of finding some of the, people who are going through this. I know you spoke to a lot of experts, but, um, just talk about kind of what that can look like and trying to convince people to go on record or even off record or on background to try to tell the story. Because with our stories, we kind of have to focus on that human interest and like have a subject. So I'm just trying to think of how to get around that and knowing how difficult it can be within the immigration space.
totally, yes. I think for this story, one of the challenges was, or just, yeah, I wanted more human and first-hand accounts. I think I kind of circumvented that by talking to the Moms Rising source, which is like an organization. So she was kind of the spokesperson for all of these other communities. And she told me, like she shared some off the record things from that she had heard from the moms specifically, that gave me kind of color and context. Obviously, not necessarily useful for the story, but she was in contact with all of those people. So I think if you could find, yeah, something similar to that, if you really can't get anybody on the record, I think I called several hospitals for this one to just try to get at least some sort of like not even a healthcare provider, but someone administrative or something like that. I was on a deadline, so I wasn't able to, but I think that could be another interesting way of maybe trying avoiding the healthcare providers themselves. And obviously the patients themselves, I think can't probably again with an undocumented community, like won't want to be on the record. But just finding people that are near them, I guess, and that can have like eyes on the scene and can speak to that. And then I think the other thing I was going to say is another thing that I learned in this story, and that I actually is a good answer to a question a little bit ago, but was about morbidity rate. And that was something that I hadn't really looked into as much, but I know that there's a lot of disparities between morbidity rate based on like race and community, maternal morbidity. So if you could get some statistics on that, like I feel like that could also be a really good way to show, like sometimes statistics can be a good placeholder for like a human, not replacement, but can be good fillers for human stories because it's this many people have had healthcare complications because of childbirth. And the CDC does a maternal morbidity rate calculator. And I think local governments also track it. So that could be helpful as well. And then I think, yeah, I mean, I think talking off the record, I never say no really to talking off the record or on background, just because I think it can always bring up something. And just I like talking to people. So I'm like, yeah, talk to me. So yeah, just you can trust that even the off the record conversations will help. Um, and yeah, I think that's it. Just trying to get people maybe who aren't living it themselves, but it's like, oh, this person has worked in this community for X many years as this. They clearly have insight on what's going on. And And then yeah, I mean, I'm sure you have like sources in the community that also trust you and trust the newspaper and trust what you're doing. So I feel like that can only help on like a local level. But yeah, if I think of anything else, I'll let you know.
Mark, did I miss see? Did you have a question?
I felt like it was pretty much answered. The only other thing maybe was about from the inception of your initial idea, from having that conversation to it actually going out. Like, what was the timeline on that? And I guess also like when you're being persistent, like you said on a story, trying to find the right angle on it. Like, kind of what are you looking for, especially if it's like like working on something for like 14th Amendment stuff right now, which is a longer timeline thing. Like what kind of aspects are you looking for to keep the story alive, keep it current, and how do you know when to like switch angles and stuff like that?
Before
Yeah.
you answer, tell her who you are.
Yeah, Mark Edwards, video producer for Washington Examiner. Yeah.
So nice to meet you. Yeah, it's a great question. I think, well, so to answer the timeline question, I had the conversation with her on Friday night, and then the newsletter was coming out the following Friday morning. So and then on Sundays before the newsletter comes out is when I kind of sit down and start thinking about topics. And that's when I started thinking about it. I sent in my pitch Monday morning. I got confirmation for the pitch Tuesday morning. And then I had all four of my interviews Wednesday morning. I had back-to-backs. It was wild. And then, yeah, so then I drafted it all Wednesday evening to th Thursday morning, and then had it ready for her on Thursday midday. So I think to answer also your question about keeping it fresh, I think we have to kind of just cut it close on timing in order to keep it fresh. I can't start brainstorming the newsletter more than a couple days before it comes out just because something crazy could happen. I tried doing that one time and then Trump got shot on Saturday. And I was like, I'm never gonna plan ahead ever again. But so yeah, I think that the benefit to that, the downside is you're on a time crunch, but the benefit is that whatever you're writing about is going to be timely. And then I saw the Guantanamo Bay stuff happen on Tuesday, and so I was like, okay, that's a great hook. And then all of my conversations were Wednesday, so I knew the story would be coming out 2 days later, so I could ask about things that were very timely and relevant. And thankfully, I guess nothing bombshell level happened on Thursday, or Friday morning. But yeah, I do keep it on like a pretty short time crunch. Um, just because I would rather do that than have to like restart. Um, so yeah, I hope that answers your question.
Yeah. Thank you.
Yeah, of course.
Last call for questions. I don't see any more hands. I want to ask a question because, quite frankly, I'm exhausted just hearing you describe the time frame of that, coming up with the idea. The next newsletter is coming out on a Friday. You got to get the pitch approved. You got to do the interviews. You got to write it. Oof. So I want to ask you something that many of the widening fellows through the past 3 years have talked about, and we've had sessions talking about the work-life balance, or how to keep from literally getting your brains fried in this process. So tell us a little bit about how you manage, again, this ability or this necessity to be an expert on a new topic every week. How do you deal with that?
Yeah, I mean, definitely it is time consuming and emotionally kind of consuming as well, because to become an expert, you do have to be steeped in everything that's going on. I think I mean, I won't say I've figured it out and that it's totally easy and chill for me. I will not allege that at all. I think I have learned certain things to kind of keep me sane. I think the first thing that came to mind was I can tend to, there's a lot of which I feel like no one talks about. No journalists I've heard yet talk about, but there's a lot of kind of like interim time as a reporter when you're waiting for somebody else, whether that be your source to get back to you, whether that be, in between interviews, or your editor, of course. Like in editing, you can't do anything until your editor gets back to you. I think when I first started would use that interim time to freak out. Just be like, I need to keep doing something, but I can't do anything. But so I think being able to take those breaks as full-on breaks and just be like, all right, this is out of my hands now, and just trusting that, your source will get back to you, or you will, you don't need to use all of your time to prepare, as I think I was trying to do. Just like rehearsing again. I think you don't need to do that. You'll be ready when it happens. And that those times can be kind of a gift because you can either like relinquish all of your power and just be like, all right, I'm waiting. Or you can use it to do, something else on your to-do list that takes like 10 minutes. Although don't do that. Just relax. But I think, yeah, using that interim time as just I'm doing everything that I can and should be doing, and that's it, and I can chill now. I think so, yeah, that provides a certain amount of downtime. And I think the other thing is just, I mean, enjoy it and feel like I can get very stressed out for sure. And feel just very, especially I think now, I did want to bring this up at some point today. Just I know now the news period is just, it's a lot. It's a lot of change. There's a lot of competing opinions and a lot of just, it's very overwhelming. And I think especially for us in news, that's what everyone tells me. I'm like, I'm a journalist, and they're like, are you okay? And I'm like, yes. So I think just being, I try to frame it as that I get to do this. I'm so lucky that I get to write about these things. This story particularly, I'm like, I'm so lucky that I get to talk with my friend, feel annoyed about something, and then do something about it. I think a lot of people are sitting with their hands tied or, don't really know where to start. And I think we have this amazing opportunity in front of us to do something, and to just be embedded within like the fabric of the world, and to actually have a little bit of a steering hand in shaping a conversation, or shaping something, shaping an outcome. So I think the gratitude and the loving what you do also helps a lot. The term work-life balance always is interesting to me. I think I'm like, yeah, I mean, there is a balance, but I think also I want to love both work and life. And I want to love my life because of my work, and I want to love my work because of my life. So yeah, keeping those things in mind, and then just generally like taking it chill and being like, I am doing everything that I need to do, and also leaning on other people. I think I started this conversation by saying that a lot of what I've learned is thanks to reporters and editors that have held my hand through things and have given me incredible advice and taken the time to edit, hard on my Google Docs. So yeah, leaning on the community that you have. And the amazing thing also about I think being a reporter, I'm rambling now, but is that there is like this specific kind of community and like mentorship. I feel like your editor is your mentor in certain ways. And I feel so lucky that I have, people whose job is to help me, write something better, and have to be as involved with the story as I am. So it's kind of like a really lovely partnership, I think. So yeah, those three things, I think. And yeah, stay strong out here.
Well, this has been a terrific conversation. And I personally am so grateful that we have such a brilliant new member of the Widening the Pipeline family in Emma Cordover of Politico. So thank you so much for being with us, and we will definitely be in touch.
Amazing. Thank you so much, all. I hope you all have a wonderful week.